आइए हम सुने विज्ञान की अनकही कहानियाँ। आइए हम सुने विज्ञान की अनसुनी कहानियाँ। एक नई दुनिया की आवाज आपकी आवाज, विज्ञान की आवाज, की आवाज।
Celebrating Azadi Ka Amrit Mahotsav, we bring you a podcast series on STEM popularization, science, technology, engineering, mathematics and medicine, supported and catalyzed by the National Council for Science and Technology Communication, Government of India. This program is produced by Media for Community Foundation. Creative content and technical support is given by Purvasha Banerjee and Shushanto Das.
एक नई दुनिया की आवाज आपकी आवाज, विज्ञान की आवाज, की आवाज, की आवाज।
In this episode of the podcast, we are extremely happy to receive a conversation from Professor Maity. He will be introducing himself and will be sharing his academic journey to the listeners.
I am Professor Biswanath Maity, presently serving as a professor at the Department of Biological Sciences at the Bose Institute. I did my graduation and masters from the Kolkata University in Zoology, PhD from the Bhabha Atomic Research Center, Mumbai, followed by postdoctoral research at the University of Iowa, USA. Then I returned back to India in 2010 with prestigious Ramalingo and Ramanujan Fellowship and joined Calcutta University again. Then moved to the Center of Biomedical Research, SDPGI Lucknow in 2017 as assistant professor and returned to Kolkata in 2024 and joined Bose Institute as professor.
Now, Professor Maity will be sharing his area of research in short.
Our research focus is to understand the impact of different proteins and their regulators in stress-induced physiology, particularly into the heart and liver function. We mostly focus in cancer and diabetes-induced multi-organ complications. One of the major focus of our research group is basically oncocardiology, which is cancer-induced cardiac problems that is very relevant towards the juvenile cancer survivors. And we are relentlessly trying how different kind of G protein and their mediators, the interactions between the different vital organ systems contribute to an overall physiology of heart and liver together towards the systemic inflammation.
Professor Biswanath Maity will now be explaining his area of research in details.
We are particularly interested in understanding how the different kind of physiological systems basically interacting with each other and how the different vital organ systems communicate in a different mode to regulate the overall physiological approaches towards the different kind of stress physiology. So this is a very relevant towards the juvenile cancer survivors because it is well known that the off-target damage to the vital organ system is an unfortunate side effects of the cancer chemotherapy, and it remains a major limitation to the use of the essential drugs in the clinic. Despite decades of research, the mechanisms conferring susceptibility to the chemotherapeutic-driven cardiotoxicity and hepatotoxicity remain very, very unclear. So we concentrated to a holistic view that considers how inflammation and their interconnectedness of the vital organ system regulate the overall physiological responses. And we are putting efforts to understand this physiology using different kind of model systems ranging from mice models, cell model, human samples, and recently cutting edge genomics and proteomics. So overall, if you just ask me, there are multiple different departments like physics, chemistry, biology, math, informatics, genomics, genetics, they are all combining together to understand and to answer a single specific question that how we can make a novel target to introduce so that we can mitigate or reduce or attenuate the cytotoxic effects of these different kind of drug-induced damages and move forward towards the positive definitive outcome. So as I just mentioned that oncocardiology and these things, I just want to pick a point here that dose limiting adverse effects resulting from this off-target damage to the non-malignant cells remain a critical barrier for the clinical utility of the life-saving cancer medications. So heart might be the primary organ, but other than heart, different kind of vital organs like kidney, liver, they also get affected. So the research is not concentrated in only one organ. It is a compactness, it is the connectiveness between these multiple different organs, how they basically work together. And as a holistic approach, the scientists, clinicians are all coming into the single platform to understand this part.
Professor Maity now shares the information regarding the position of India from global perspective.
Cardiac-related research in India is slightly less explored compared to the cancer research overall. But the incidences of cardiac events through various reasons, mostly life cycle related disease, drug induced conditions, are continuously increasing worldwide as well as in India, and most importantly, crossing the incidences of cancer overall. The particular focus on oncocardiology is really less explored in India. Just for example, we still don't have any cancer induced cardiac problems registry in our country. If I have to say more lucidly or in a simple language, the documentation and reporting of the patient data with follow-up details to a single national platform is not getting strictly followed by all the clinical organizations, government and 100% private. That is actually causing the less awareness about the program of different non-communicable diseases currently Government of India is running. Multiple basic science researchers around the country are working on different aspects of this physiology, but the progress towards the unified nature is still in doubt and in infancy, and I think cardiac research must be putting forward with a more rigorous effort in this country to withstand the present societal problem as well as the what future incoming.
It would be best to hear from Professor Maity about his contemporaries in this area of research.
If I have to start with the India part, then multiple basic science researchers around the country are working on different aspects of cardiac and liver physiology. Professor Nitish Mahapatra from IIT Chennai is studying the impact of hypertension on cardiac damages. Dr. Dhandapani from INSTEM Bangalore is working on cardiogenomics, stem cell, precision medicine. Now, Professor Ravi Sundarasan from IISc Bangalore is now working on the protein modifications in pathological heart disease. Dr. Sanjay Banerjee from Naipar, Assam is basically trying to identifying and validating novel targets and therapeutic interventions for cardiovascular and metabolic disorders. I must say one thing here about our country's progress. In the last decade, the impact of cardiometabolic research has taken a serious upliftment in our country. Awareness program has been set up. Funding agencies are continuously putting money to understand the intricacies of these pathologies and discover novel biomarkers for future drug development approaches.
Professor Maity now speaks on the way forward and also focuses on the partnership of industries.
See, if we talk about the future, then multiple different industries as well as the different research organizations are putting their efforts simultaneously in a single platform to understand that how these different kind of stress physiology, drug-induced conditions that altering different kind of organ pathology can be tackled, and different kind of novel approaches, instruments, biomolecules can be designed to prevent or attenuate this effect. I must say one thing here that multiple industries are now partnering with the Government of India through BIRAC and the other national programs for narrowing the search to identify the novel target proteins and the relevant physiological pathways, aiming a fruitful outcome of developing specific bioactive molecules to reduce these cytotoxic physiological impacts. This needs a extreme collaboration with the chemistry and the physics people, because they will in future develop these biomolecules towards the drug approaches. These physics people will try to understand the intricacies, how the different kind of cellular mechanics are performing in this biological phenomena. Most importantly, that Government of India is continuously putting effort to mitigate this thing so that it can reach towards the lowest part of the society, the people with the less earning and without earning can get the proper treatment benefit to the government hospitals, and they have put forward a different kind of government programs. One of the major programs is like Ayushman Bharat. So that is a exceptional program that reaches from top to the bottom. Now, through these programs, if you are talking like they are giving different kind of free drugs, they are going for the generic treatments because the generic treatment is less costlier. Obviously, the things are much more costlier. The drugs are longer like time frame process are going on. But I think the government has put forward their efforts through different kind of budgeting, different kind of like distributing to the clinics, free hospitals, even into the private. They have put forward some rate that you cannot take beyond this so that people get the correct effect of this, mitigating this problem. And otherwise, I think they are also trying to put forward policies how this kind of drugs should be manufacturing in, because we have a tremendous strength in the chemistry related research. Problem is that few APIs like active pharmaceutical ingredients, we have to buy it from the different other parts of the world like China and other things. But government is putting that restriction that India should be making these APIs and make these generic drugs in our country, so that treatment cost as well as the generation cost of these like rare medicines and these very life-saving condition medicines should be prepared in India. So I think in the overall future, like might be in 4-5 years, you can see this kind of turn of event, because these are all policy decisions. When government is putting down their feet, absolutely everybody has to react accordingly.
We are really grateful to Professor Biswanath Maity for sharing his experiences.